My guest today is consultant ear, nose and throat surgeon Dr. Olawale Olubi with the Lagos State University Teaching Hospital, LASUTH. Welcome to the program, Dr. Olubi.
Oh, thank you for inviting me.
All right. By the year 2050, over 700 million people will have disabling hearing loss. What could be responsible for this development?
Yes, a lot of people will have hearing loss, and that is about 10% of the population. What is happening is that we are exposed to a lot of things in the environment, especially noise. And that noise comes from different forms. Loud noise in the religious home, the recreation grounds, the parties that we go to, and all this play a lot of parts in making our ear go deaf. So we need to do a lot of preventive measures.
Could the narrative be
so if you don't take good care of it, it's going to continue.
All right. Could the narrative be attributed to lifestyle or hereditary?
Hearing loss can actually come in form of three forms. One can be born with a hearing loss, which is called congenital. And the other one is acquired. And the third one is genetic, the ones that runs in the family, the gene. So the one of congenital, one can prevent it by using indiscriminate use of herbal drugs in pregnancy, and exposure to radiation. And sometimes infection in pregnancy can actually cause this. So one has to be very careful not to expose pregnant women to that. Then the acquired one, that's the noise in our environment I mentioned earlier. The genetic, you can't do anything about it. What we'll have to do, the one we can do about genetic is preventing those who have the traits from getting married. But that means you have to do a lot of genetic typing to know those who have traits or those that hearing loss runs in their family so that they don't get married. So we try to prevent those family members marrying each other so that you don't get profound hearing loss.
Okay. According to this recent research, over 5% of the world's population require hearing rehabilitation to address the hearing loss condition. How do I know I have this condition, let alone preventing it?
Well, the newborn, definitely by the time you expect them to start hearing you, obeying instructions, they will not be able to obey instructions. They will not react to sound. And by the time they are supposed to be speaking, they will not be speaking. The other one, as you grow older, for those who have started speaking before, they will find out that people will just start saying, I've been talking to you, you're not hearing. People will draw their attention to it. That, oh, we called you, you didn't hear. So that's when you start knowing that, or you find out that people are talking in a boardroom and you are not hearing what they are saying, whereas everybody is either nodding their head and saying, I can hear them. And that will affect children in school and workers at work.
In this part of the world, we hardly visit hospitals, let alone ENT clinics. You hardly find people visit ENT clinics unless they are life-threatening situations now.
Yes, I agree with you. That's why what you're doing is quite important. We need to enlighten them. A lot of people have to know about it. Just like you're doing it from the media, from the print media, and from people telling people around. We will do our own parts by educating patients when they come to us. But the family members, the community members, the government, the media have to pass the message down. And that's why we have to get them to know. And we should be around them to help them too. So those are the things. So awareness and availability, proximity to availability will make a lot of difference.
From your response now, it is obvious that the conditions are preventable. I want to know now, when do I need to see a specialist? Is it treatable? Are these conditions treatable?
Depending on the severity, there are some that are very treatable, but majority, over 94% are treatable. It's just for you to go to the right place. And the right place, like if you go to the right place, like you see a trained nurse, a trained doctor, and they will be able to refer you to where the services are being rendered. For instance, it is rendered in the Lagos State University Teaching Hospital, where you have all the specialists and they can take care of all the sort of hearing loss.
When does hearing aid becomes important to use, and when does cochlear implantation becomes imperative?
Okay. Just like how we use glasses when we can see. The glasses we use is a visual aid. So when we can't hear very well, we need hearing aid. A hearing aid is meant to aid the hearing, amplify it. But the hearing aid has limitation. The limitation is that it cannot when people cannot hear the speech properly, it cannot recode it. Whereas cochlear implant can actually bring it up and make sure the patient understands the speech being spoken. The hearing aid also amplifies a lot of things in the surrounding, but the cochlear implant only try to get the speech and synthesize and filter it so that not all the noise in the environment will go to the ear. When those people use cochlear implants is when the hearing aid has failed to satisfy hearing. People can be hearing what is sound but cannot understand the sound. So when they are not understanding the sound, hearing aid is quite important. So that is when, so we advise that people should try hearing aid for about 6 months. If it doesn't work for them, then we then advance to cochlear implant.
Are there risks, complications, and disadvantages of cochlear implants now?
Well, we'll talk about advantages rather than disadvantages, because the patient is already disadvantaged by not hearing. Not hearing is like taking the person away from the world, because the person does not hear the sound of a bird sing, is not appreciating any sound. Even if there's crisis very near to the person cannot hear it and quickly run away. Even if they're talking bad about him, maybe they want to kidnap him beside him, he can't not understand. So that's a disadvantage to the patient. When the patient now uses cochlear implants, that makes it improve. What you can say about cochlear implants is like any surgery, complications, which can come in form of complication of surgery and complication of anesthesia. But with nowadays, a lot of patients goes into the surgery and come out of anesthesia without any complications. Very minimal. It's just like any other surgery.
Okay.
So no much complication. It's not like there's some specific complication, but we are trained to avoid the complications. So most of the time they are minor, and that can be taken care of in the hospital and by a trained person.
Talking about surgery now, I would like to ask you, who is eligible for a cochlear implantation now? Is there age limit?
Oh, yes. That is an important question that you just asked, and that determines a lot in the success of the cochlear implant. Those who are eligible, we call them candidates, and we do candidacy. Number one, the person that cannot hear in both ears. It has to be profound hearing loss in both ears. It has to be those who don't understand speech properly with with hearing aid. It has to be those who have used hearing aid for 6 months and it has not benefited them. So it now boils down to two categories: children and adults. Children who have not learned how to speak before, you can put cochlear implants but it has to be done just before the age of 4. Before you to put it on a scale of 0 to 10, as you move closer to 10, the outcome is not as good. But as you move closer to 0, the outcome is superb. So early detection is quite important. That is why we advocate that people should do hearing screening at birth. Newborn hearing screening should be legislated, and people should make sure that every newborn baby is screened for hearing. So by the time you detect them early, you can easily implant them. It is easier for adults who has actually achieved speech before. It will just be like a magic ear. When an adult puts it in a ear and it has actually achieved speech before, the adult will just start understanding everything one is speaking, and that is fantastic. So adult children, because a child still has to learn the language, the impact is not shown instantly. But in adults, it's like magic.
What about people with hearing and speech defects? Now, are they also entitled or are they also eligible for this surgery?
Yes, if the speech defect, that's if it's not used for speech, it's used for hearing.
Okay.
So if it's associated, the speech defect is associated to hearing loss, severe hearing loss, because once you don't hear very well, the speech will be distorted.
Okay.
So it is used for hearing loss, not speech.
All right. After the surgery and after the implantation, are there therapies needed after the surgery, living with the implants now? How soon can a patient go back to their normal routine?
I'll just go through the process of the surgery.
Yes. Go ahead.
After the candidacy, we determine which side we want to actually implant. We go most of the time for the worst ear.
All right.
So when we go for the worst ear, then we try as much as possible to look at, if the surgeon is right-handed, we go for the right hand. If the both of them are the same. So we go for the right side, and once the surgery is done, a drill is drilled and the implant is put into the ear. We test for the implants to know actually whether this is in the right location and whether it's working inside before we close.
All right.
And we allow this to heal up. And when we allow this to heal up, we now allow the wound to heal over 3 weeks. Then we put the cochlear implant on. That is called switch on. We switch on the cochlear implant. That's when the patient starts hearing after 3 weeks.
All right.
Then we now set it. We call it mapping. And the mapping is that you put it to the comfortable level for the patients, because we all have different comfortable level. And once the patient gets that, then the patient can hear. For children, you need to do a lot of speech therapy. And the speech therapy usually takes about 6 months to 1 year.
Wow.
So that will have to be arranged before the implant is done, so that the speech therapy is ready to go through with the patient all through. And the parents play a major part, because the speech therapy will be as if the patient is going to school. But you can't limit to 1 or 2 hours that the speech therapy is going to spend with the child. The parents or the caregiver would have to learn how to do that and continue it intensively at home for a period of over 6 months. And once the child has done all that, that's the end.
All right, Dr. Olubi, thank you so much for that detailed explanation. Now, I'm going to ask you, what is the success rate? Is this kind of surgery affordable, and how do members of the public access this treatment?
One is the success rate.
Yes. What is the success rate? Is it affordable, and how can members of the public access this treatment?
Okay. One is the success rate. The success rate is very, very good. So far, the candidacy that we mentioned earlier is done properly. You can't have somebody who has been deaf for 15 years now to come and start being implanted.
Wow.
And has never hear any sound, has never used a hearing aid to come and get a cochlear implant, that cochlear implant will not work. You have to choose the right candidate for it, and once you choose the right candidate, it's almost 100%.
Wow.
So the other one is it affordable?
Yes.
It is not. It does not come cheap. But like every procedure or any kind of events, if you're introducing it new, the more we buy the cochlear implants from them, we can now start negotiating as per bulk. That we are getting more, then the price will go down. Initially, it's going to be high, but as more people do it, the price will go down. It's just like when GSM came into the country, it was very high. But now everybody can afford it, and that's what we're hoping for cochlear implants. Where to get it? We have specialists and that we can do it in lawsuit. So they can come to the Lagos State University Teaching Hospital, ear, nose, and throat department, and ask for it, or ask anybody in the lawsuit management, and they will be able to direct them to the appropriate place. Once you enter lawsuit, you'll be able to access us.
Okay. I know the Lagos State government through Lagos State University Teaching Hospital offer this care, but people don't know about it, let alone ENT services. People use all sorts in the name of treatment. What advice do you have for members of the public in this regard?
The members of the public is, in any disease, prevention is quite important.
Yes.
We need to prevent hearing loss. We need to detect hearing loss on time, and we need to treat the hearing loss. As per prevention, we don't want any pregnant woman to use any form of drugs, use any apps without the doctor's consent. They should go for proper antenatal care. There are a lot of maternal and child institutions in Lagos. Lagos State has done beautifully well. So they can attend all that, not going to places where are not registered. So once they can do that, we have less of that. The proper childbirth, we should prevent neonatal anesthesia, that's your child being choked when they are being delivered. Report jaundice in children very early. Those are the causes that can actually happen. So once we do that, then for the public exposed to noise, anybody that is making too much noise, report them to the Ministry of Environment. They have policies that they can use to take care of them. And we should avoid noise like a plague. Not using drugs that are not totally prescribed, and using telling doctors if you have some kind of hearing loss, or you have hearing loss in the family, that I have some things, so the doctor will avoid drugs that can affect the hearing. And the last one is we should advocate early screening, early detection, treatment. We all need help in these aspects. What to do individuals in the community can help those who are deaf. The non-governmental organization, the government cannot do it all. Government has tried at one point in time. There was a time government provided hearing aid for thousands of individuals in Lagos. And there was a time government sponsored 10 cochlear implantation. We hope that they will continue to do that, so that the people of Lagos State can continue to benefit from this. And once we can do that, support will definitely be good for the patients.
All right. Well, this is all we have time for, Dr. Olubi. We appreciate your expertise and insight. Thank you so much.
Thank you very much. It's a pleasure.
That was Dr. Olawale Olubi. He is a consultant ear, nose, and throat surgeon with the Lagos State University Teaching Hospital, LASUTH, on preventing hearing loss through cochlear implantation. LASUTH offers the state-of-the-art cochlear implant surgery in the country. In fact, the hospital pioneered the service to restore and improve the ability to hear and understand speech in Nigeria. Sound Health continues with trending health